what is finance, and not just mobilize finance, but how can we make sure that it's driving impact? How do we measure it? How do we track it? How do we ensure that what we're doing is actually having an impact at a local level, but also is able to do so at scale? So for that conversation, I am very pleased to introduce Dr. Neal Buddy Shah, the CEO, the Clinton Health Access Initiative, and Professor Padmasree Gill Simpath, the ICEO of the African Pharmaceutical Technology Foundation. Thank you for joining us today. Thank you again. So I'd like to start off to set the stage and really frame the conversation and the conversations that will be held later on today as well as part of this forum. So, Buddy, I'd like to turn to you first. You know, you are working on the ground in countries around the world and mobilizing finance that will very much drive impact. And so when you're thinking about the environment that we're presently in, one that is resource constrained and complex challenges that are, battling for resources in some instances, and in an environment where there's increasing debt, particularly in low and middle income countries around the world, what are some of the key trends that you're seeing in this space, and what are some of the ways that we can start addressing them?
Great, thanks, Allison. It's a pleasure to be here. You know, as we think about the UN high-level meetings on universal health coverage and tracking progress towards 2030, I think everyone's in agreement that we're not on track to hit those universal health coverage targets by 2030. But that having been said, if we look back at the last 20 years, I think there's been incredible progress in global health. We are coming at the back end of 20 years of huge amount of growth in global health spending. And that increase in spending has translated into, frankly, some of the biggest social impact wins that humanity, I think, has ever accomplished. So if you think about the creation of organizations like the Global Fund to Fight HIV, Malaria, and TB, the Gavi Alliance for Vaccines, President Bush's PEPFAR initiative, these are things that in a really empirically defensible way, have saved the lives of tens of millions of people over the last 20 years. It's halved the rate of death from HIV, TB, and malaria in just 20 years, and that's absolutely incredible. And so there's a lot of success to build on from those 20 years of investment. I think the thing that concerns me is that we're entering into a period where there's a lot of risk for global health financing. And I know previous panelist Neal said that we shouldn't think about this as competition, but the reality is there is competition for resources with climate change, with the war in Europe, and also I think a certain degree of domestic retrenchment around our obligations to other countries in the world. And this is all layered on top of increasing debt burden for a number of countries in the world. And so the question is, what do we do about this? How do we maintain the gains of saving so many lives so cost effectively in light of those macro financing challenges? And I think there's three types of solutions. The first is having more impact with the same amount of money. Over the last 20 years, we've really identified some of the most cost-effective ways to drive down maternal, neonatal deaths, vaccine-preventable deaths, and infectious diseases. And I think there's an opportunity for us to get more rigorous about investing in the most cost-effective ways to save lives and reduce the burden of disease by investing in proven solutions. I think the second way of having more impact with less money is using capital more creatively. I had a conversation with Noubar Afeyan, the co-founder of Moderna, yesterday, and he said it's amazing the types of discontinuous advances you can have when public financing is married with private sector ingenuity. And by giving a signal to private sector pharma innovators around, if you're able to develop breakthrough drugs that disproportionately affect low and middle income countries, the global community is going to guarantee you certain amounts of payments at certain price and certain volume, I think can go a long way towards making sure that innovation and R&D in the biomedical space is not just targeted at high-income countries, but at the health issues of low and middle-income countries. So that's on having more impact with the same amount of money. I think secondly is reforming some of the financing globally. I think the debt burden, 3 billion people around the world live in countries where paying the interest on debt is more than what they spend on health or education. And I think there's opportunities to reform multilaterals and the debt burden. And then the third is we have to crowd in more money. In the mobilization of climate resources, only 0.5% of funding is going towards health. And I think that even not as a health partisan, that's just a dramatic underinvestment since climate change ultimately manifests in negative health outcomes. And so how do we make sure that as the global community mobilizes a lot more money towards climate change, that there's the adequate amount going towards the health effects of climate change? So I think there's a lot of very practical things we can do in order to continue to build on the momentum of the last 20 years in saving lives, frankly, with extremely high value for money.
Yeah, thank you for that. And you make such an incredible point about the mobilization of resources, but making sure that it goes as far as it can and that's being utilized efficiently and driving that impact. And so I'd like Padmasree to turn to you, and you're now leading the newly formed African Pharmaceutical Technology Foundation. And, hearing what Buddy just said and thinking about your role, how would you characterize the landscape that you're seeing in Africa as it relates to the mobilization and deployment of financing that can have real impact? How are you making sure that you'll allocate those resources effectively?
Thank you, Alison. And I think in Africa, we're seeing a couple of really pressing challenges in healthcare. We have a rising burden of non-communicable diseases. We've got to deal with threats of pandemics. We've got epidemics surging here and there. And we also have to strengthen, actually, healthcare infrastructure, which has suffered, actually, under COVID-19. Africa has an enormous potential right now to participate and to have a voice in its own health care financing and building its own healthcare infrastructure. The first trend that I think is really important is that we've got a whole set of African institutions now which have emerged and are being strengthened at the African Union level. There's very strong investment by African member states and by the African Union in trying to change the historical way we look at healthcare infrastructure in Africa. So we've got not only the Africa CDC, of course, which plays a key role, and we've got actually the African Medicines Agency, which has been created. We've got the African Continental Free Trade Secretariat, which is trying to mobilize the region into a single sort of like trading region. And we've got agencies such as ours, the African Pharmaceutical Technology Foundation, which has been created specifically to reinforce the capacity of African actors in both the public and the private space to invest into critical healthcare infrastructure components in the region. As the African Development Bank, the regional development bank in the region, we are very heavily invested also in supporting these institutions. So we've got a new pharmaceutical sector strategy at the African Development Bank, which has actually put aside a $3 billion US investment into building Africa's pharmaceutical sector. We've also got the bank's healthcare infrastructure strategy, which tries to boost and crowd in financing within the African region, because we need about $26 billion in annual investment over the next decade to build Africa's healthcare infrastructure. And we're going to work very closely with all African governments and African institutions in making that happen. I do want to say one thing, though. A large part of our healthcare financing and healthcare investments in Africa go in sourcing stuff for the healthcare systems that we can produce locally, and if we would produce locally, we would and create the supply chains for it, we would probably have more timely allocation of those healthcare inputs, whether they are vaccines, whether they're drugs, whether they're personal protection equipment, other kinds of diagnostic equipment that we require in the healthcare infrastructure. And we can also increase actually our participation in providing those healthcare services within Africa. And I think that for us at the Foundation and also the African Development Bank, strengthening that capacity in the region to do that for ourselves is a very, very big priority. And in that process, we want to reduce two kinds of risks that are very, very important risks in the region. One is a transactional risk, so a lot of the transactions that occur in the healthcare space, they are actually foreign exchange transactions where, African countries and African firms have to deal with currency fluctuations, right? And that actually affects the amount of money that's invested into healthcare financing and the ways in which we're able to leverage that actually to achieve maximum healthcare impact. So we are working very closely with countries to reduce that transactional risk. The second thing is the translational risk, you see. So when African firms invest into certain products and into producing, we need to make sure that they have the right kind of support structures. They have the markets that are needed, and we are aware and clearly supportive of procurement of those products into African healthcare systems. And those systems are well set up. And that's something that we're also working very closely in the foundation. A final thing that I want to say is that we've had, and I think Buddy's made this point, we've made a lot of progress in the global healthcare financing space. But what we need to do, and why we're lagging behind, is increasing the African voice in the healthcare space. And I think that this is something that we are really working towards in the region. We want greater participation of African institutions in mobilizing healthcare financing, in setting those healthcare financing priorities and in implementing them.
It's such a good point, and I'd love to pick up on that because you're both talking about the mobilization of finance by different entities, different groups. There are resources out there and capital is being mobilized. But how can we ensure greater alignment and harmonization among those activities so that they're streamlined, they're not redundant, there's greater efficiency and coordination? And just, Padmasree, as you're mentioning, there's a local voice, and those agendas are really being driven by those locally and local governments. So, Buddy, I'd like to turn to you. What is your perspective on that, and what can be done to better harmonize and coordinate that activity?
Yeah, I think it's a great point, Padmasree. At CHAI, we work in 36 countries around the world, and we often think of ourselves as the plumbers of the public health system. So we're behind the scenes trying to find what's clogged up where and do the unsexy work of unblocking it. And when we speak, and when I speak with ministers of health all over the world, one of the things that comes up repeatedly is that it is very challenging to have a ministry-led, one plan, one budget, one execution model, given the number of voices of different donors with their own priorities, which are well-intentioned priorities, but often only partially overlapping with a cohesive, unified, ministry-led plan. Now, there's definitely been countries like Rwanda and others that have done an exceptional job of executing one ministry-led plan, one budget, and then you can either put money into that or not, and they're willing to reject money that's not aligned with the government-led plan. But there's a lot of work to be done on advancing that. And I think there's two different axes at which to do that. One is at the global level. There are these amazing global funding institutions like Global Fund, Gavi, and others that I think have the intention of thinking more about how do we align our spending globally, have the intention of making sure that it's harmonized at the global level, but then also in country at the national capital level, there has to be real intentionality and resources behind making sure all of the different funding streams, whether it's domestic tax revenue, global multilateral debt financing, or grant financing from these big multilaterals, feed into a single plan. And I think if we don't do that, it's going to continue to burden ministries of health. And so I think that's the key thing, to put ministries in the driver's seat in developing the plans and having all of the money that comes in be harmonized against ministry-led plans.
So we're about out of time, but I'd like to ask one last question to you both on that point. We're here this week where there are a number of funding agencies, a number of practitioners, ministers of health. What would be wins this week? What are some practical next steps that can come out of this opportunity to convene to really drive that action going forward? Padmasree, over to you.
I think a very important win would be that in these meetings that we sort of give a front and center seat to African institutions and African representatives actually to shape the agenda. For me, that would be very important. I mean, the African Union has now joined the G20, but I think that we need a stronger voice in shaping the regional response. We also need, I think that, in agencies like Gavi, GFATM, and so on, I think it's important to start thinking around, how do we work much more closely with Africa as a region, and how do we actually shape the responses that we have had for HIV/AIDS, for vaccine access, and so on, the successes. But start thinking around, how do we do that, taking into account the changing trends in Africa itself. And not only that it's a large market, but that market is a very big lever, actually, in terms of creating domestic capacity, in making sure that the region is actually ready and fit in the coming decades, actually, to respond to its own healthcare challenges. This is something that I'd really like to see.
And Buddy, what about you?
Completely second Padmasree's point, and would extend it to other countries, low and middle income countries, Southeast Asia, South Asia, and Central America. Two other things I'd quickly add. One is climate change ultimately manifests as health impacts, and it's unacceptable that between 0.5% and 2% of climate funding is going to health, and that needs to change. So I think that's one. And then secondly is there is so much to inspire us over the last 20 years of saving lives at high value for money that we need to continue that momentum. Now is not the time to sunset global financing for global health, but instead to learn from that as one of the greatest accomplishments of humankind and double down for the next 20 years to close this gap where, by the luck of birth, if you're born in a low-income country, you're going to live 20 years less than someone who happens to be lucky enough to be born in a high-income country. And there's a very clear pathway towards erasing that gap as long as the global community stays focused on it.
Very well put. Thank you both. Thank you for your time today. Best wishes with your work going forward. Dr. Neil Buddy Shah and Professor Padmasree Gill-Sampath, thank you for joining us today.
Thank you, Alison. Thank you.
Now for our next conversation.